I'm good.
You're looking younger every day. What have you been eating?
Maybe it's the stress.
No, it can't be the stress. Stress can't make you look this good.
Stress is taking away my hair.
You're becoming more presidential if you don't have hair. I mean, that one.
I have to reduce my height too.
Yeah, no, that level there you can't. That level there we're in a comfortable lead. We're in a comfortable lead. Yeah.
How you been?
Very well. It's an honor to have you here again. Let me just take this one. This one says a happy birthday to Tina Sakifio. God continue to bless you and grant all your heart desires. Enjoy your day from your brother and his wife, Mr. and Mrs. Sakifio. And Doc, you know what? A lot of our listeners are saying this particular song that's playing in the background, I need to let the full song play. So let's enjoy the song and then we'll come back and we'll talk health. All right? Here is Still I Love You from the late Dasabre Awofe Jamina.
Drive time on Joy 99.7 FM. Yes, it's a yadi de kawa. Yes, I'm mama. To my garden. The big to my garden. I'm making you a baby to go. Matching, shabby door. Just love, I wonder what's from it. Just love, I wonder what's from it. Yeah, boy, I did you not have no one, maybe I'm one. I mean, still I love you. What dear, my papa, fucking me too. Still I love you. Mommy, baby, my dear chick, for me, still I love you. Copy me, baby, kawa, walk to me, dear, still I love you. Don't me see my son, boy. And still be the other to any other. Another pimping my mom for a what room we are carrying for.
Drive time on Joy 99.7 FM.
So everyone says I'm a Kosia filler, but it's not like I'm nosy or go out to find out the latest filler. It's just that I get 50 megabytes of data free after paying for only the first minute of every call. And so I just keep discovering stuff minute after minute. That's how come I was minding my business, scrolling through my timeline, and I found out Koko has a new baby. Oh, and last week, I learned Ken won the lottery. You see, Ken is my brother's friend. So hello, look who's about to roll with the rich and famous.
Enjoy even more value with MTN Free After One. You only pay for the first minute of your call on MTN Free After One, and the rest is free. Plus, you enjoy free 50 megabytes worth of data to browse your favorite sites. Compare where, compare dance. So dial *315# to sign up.
We day for you everywhere you go.
Terms and conditions apply.
Charlie life may be easy.
You know, at my office, where all my workers come see that they go bank, so I follow them. Can't see how they sit in the canteen, they laugh plenty. Everybody there, my phone talk. As I catch there, I shout, freeze! Where ask them say, this be banking hall.
Oh boss, with the bank phone and phone stop.
This your young phones?
Oh yes boss.
How you go fit bank for top?
With Access Bank, even young phone says, you go fit do mobile banking. Hey, you just for dial *901#.
Wow.
That be all. You go fit open account, buy airtime, check your account balance, pay bills, move money from your mobile money wallet to your bank account, then play dating.
That'd be wonderful, man.
Yes, boss. Boss.
Yeah.
I beg, what did they do?
I did dial *901#.
No data? No problem. Just dial *901# now and experience easy, safe, and secure mobile banking from Access Bank. Call toll free on 0800 004400 for more details. Access Bank. Best bank in customer service. Access Bank. More than banking.
So time check, it's 40 after 4, and we're in the studios with Doc, and we're going to be talking COVID. Quickly, let me say happy birthday to Alexander Hato Robertson, Mova 91. Happy birthday to you, comes from my big brother, Niama. Doc, so let's do a quick recap. And I didn't know it was pouring out there.
It is, yes.
Oh, I didn't know.
Yeah.
I'll play some romantic music that warms us into the late night express later this evening, you know.
Don't worry.
But we'll do that.
Yeah.
Take us to last week so that we can talk COVID.
Right.
Just a quick recap for those who missed.
Thanks and good evening to all our listeners. And last week we started a conversation, on the pre-existing medical conditions and then COVID-19. You know, George, this COVID-19 has introduced a lot of terminologies into our everyday conversations. So quarantine, social distancing or physical distancing, and then now we also heard a lot about pre-existing medical conditions. So last week we started the conversation. What are pre-existing medical conditions, and how is it that those, when you look at the spread, those who tend to have the severe forms of the disease tend to have certain medical conditions prior to they being infected with the virus. So a pre-existing medical condition simply is any medical condition that predates infection by the virus, or sometimes even a situation. I call it a situation because it may not necessarily be an illness. So I mentioned diabetes as an example. That most patients who suffer poorly controlled forms of diabetes, or if you have diabetes and your control is not that good, if you get COVID-19, then you tend to get a more severe form of the illness. George, remember we have people who have the virus but are asymptomatic. They are without symptoms. Then a large majority, over 80%, have very mild symptoms, a cough, cold, a bit of a fever, and then that's it, a sore throat, and then they tend to recover. Fortunately, in our part of the world, in Ghana, we seem to be seeing a lot more people with mild symptoms. Then
somebody said it's because the Chinese sent us a fake version of COVID-19.
Well, thankfully, now there's a benefit to getting something.
So there's a fake version.
Thankfully, we are seeing the milder forms of the disease. Then a few people would get what we call the severe infection requiring oxygen supplementation or hospital care. And then a few people will also get what we call the critical illness, where they would need a support from a ventilator and also ICU care. So these pre-existing conditions are the things that we mentioned last week, and there are a few things that I just wanted to quickly recap. So I mentioned diabetes, which is a situation where you have high blood glucose. It tends to decrease your immune system function generally and your white cell function. The white cells are the soldiers of your body. So if you have diabetes, you have a syndrome, a situation we call slow white cell syndrome. Your white cells don't move and function as efficiently as they used to in the past. Some people are also on steroids for very good reason. We use steroids in the hospital for a number of medical conditions.
When you said steroids, my mind went somewhere else.
I know people also use steroids.
I was looking at Philip.
I won't look at him.
You can look at sorry.
Medically, we use steroids for a number of reasons. People suffer from asthma, for example. We use steroids. We use steroids for hormone replacement therapy, and so on and so forth. But steroids also function to decrease the efficiency of your immune system. All right, and the immune system is the main defense mechanism you have in fighting COVID-19. All right, so the use of steroids for good reasons. Those who are on steroid medications may have to be very careful, or they succumb, or they get the more severe form of the illness. Malnutrition is also something I mentioned last week. The immune system is largely made up of proteins. So those who are malnourished, chronic malnutrition over a long period of time because of the socioeconomic conditions, proteins are gotten from meats, eggs, fish, and most of the time ours is a carbohydrate-based diet.
Those who buy kinky without fish.
Exactly. You know, things like the Gary Suki.
A baby on rocks. That's what we call it. Gary Suki. Without granules, it's a baby. But if you add rocks, it's a baby on rocks.
I see. You know, so chronic malnutrition also puts you at an increased risk. Old age. You know, again, if you look at the data, then the elderly tend to succumb a lot more to serious forms of the COVID-19. I was looking at the data published on the last 4 deaths that on the Ghana Health Service website. There was one 21-year-old, which is an outlier, but then the rest were all in their 60s to 70-year-old. So predominantly it is the elderly individuals. And as we all age, the efficiency with which all our systems, body systems work, also tends to go down. Heart disease, chronic kidney disease, hepatitis B infection, all these things are what we've put together and know as pre-existing medical conditions or comorbid conditions. Yes, that tend to worsen it. And the whole point is that if you have an illness that affects your cells or tissues that COVID-19 would also affect, then you are at a greater risk of succumbing or getting a worse form of the illness. That's the underlying principle.
Interesting. Let us quickly open the phone lines. I'm sure our listeners may have questions on their minds. 0302216541, 0244340437. I have a particular question that, but we just entered our rainy season, and when we're following the international news, one of the things that I think I heard somewhere was the possibility of the weather having an effect on them. The colder it gets, the weaker. So now that we've entered our rainy season, could we be more susceptible? Is it possible?
Right. So, George, they are looking at the seasons with respect to what happens in the Western world, where they've got the winter, and then they've got summer
and all those things.
So, if you look at the trend, this thing started somewhere around in January.
Yes, it did.
All right. So, where the peak of the winter, January, February. And they took a hit. We're entering summer now, and in most places, or spring. It's spring in most places, and it tends to be milder. We're seeing a regression. So in Ghana, even the rainy season, the weather, the temperature. I mean, people will say it's cold, right? But if you check the temperature,
it's still hot.
Like people come out with their jackets and all of that, saying that it's cold. So yes, there's a belief that the colder it is, the flu viruses tend to thrive.
They thrive better in
very, very cold periods. And we are talking about winter cold. We're not talking about rainy season in the tropical region cold. So I don't think it will make
it could be a big deal. 0244340437 0302216541. Those are telephone lines. Just call us. Doc is here so that you can just have your questions cleared once and for all. I mean, and then there's... let me go to the phone line. Hello?
Right.
Hello. Hi, good afternoon. Your name and where are you calling us from, please?
Good afternoon, George. How are you?
I'm very well, thank you. Your name too and where are you calling us from, please?
George, my name is Yaw Osafo.
Oh, yes, sir. PK.
Yaw Osafo, yeah.
How are you doing, sir?
Yeah, I'm fine, thank you. Not so good because it's raining. We know when it rains, we know what happens to Ghana.
Yes, so...
People have babies.
Can you permit me to do a little education?
Please go ahead.
So the word is novel, not novel.
Novel. Okay, thank you. Novel coronavirus. Thank you very much.
Yes. And my question to Doc is, Doc, you made mention of mild, severe coronavirus. Does it mean that there are milder versions, severe versions of it? Because I was of the opinion, of course, a layman, that if you get it and you leave it untreated, and your immune system is weak, then it actually graduates from mild to severe. You know that in diabetes, you have type 1, type 2, and you guys know how to... So my question is, because you said severe and mild, I want to know whether it is negligence or... I hope you understand what I'm
telling you.
Thank you very much.
All right, thank you, PK, for the question. Very good question. I think there are two concepts here. We want to talk about the various clinical presentations of the disease. So COVID-19 is a disease, and it presents in different forms. So you've got,
go ahead.
You've got mild symptoms of the disease. Depending on the state of your immune system and all the other factors that we are still continuing to understand. Then you've got the severe form of the disease, and then you've got the critical form of the disease. So this is about disease manifestation. There are a lot of factors that determine how it will present. It may not necessarily be somebody's negligence, and that's why we talked about the comorbid conditions. I mean, if you suffer from type 2 diabetes, if you suffer from a heart condition or chronic kidney disease, it is not your negligence.
Exactly.
It is just that
it's just
you have
your situation.
Yes. the other concept that he was trying to address was the concept of strains of the virus.
Exactly.
So I think a couple of weeks back, we all applauded ourselves and the people at Noguchi because Ghana had submitted or identified a particular genome sequencing of the or a certain strain of the virus. So the virus comes in different forms, and we continue to learn about the different strains. So I think at the last count, there are about 70 different types in terms of the sequence, the genetic makeup. So everybody's putting in, there's a database that is collecting all these stuff. And we believe that if you have a certain type of strain, you were saying that they sent us a fake, or we got a fake version. We talk about strains when we talk about germs, whether it's bacteria or viruses. You can have strains that don't produce a severe form of the disease, and you can have strains that
can kill you,
a very severe form of the disease. So those are the two.
Let's go quickly to the phone line so that we can come back to the explanations. Hello?
Hello, George.
Is this Augustus?
Yes, sir.
Augustus, good evening. Talk to us.
Good evening, George. Hi. George.
Hi, thank you.
George, please, I want to find out from doctor. I'm having a pre-existing condition or underlying condition or comorbidity. Indeed, I'm a diabetic. Apart from observing all the preventive etiquettes or protocol, what do you have to do, to avoid contracting the disease? And indeed, I'm also blind, so and then at the same time a teacher. So I don't know how, in case if I should go back to school, how I'm going to manage the whole thing. Can the doctor please educate me, about what to do, please? Thank you very much.
All right. So thank you for your question again. And if you have a pre-existing medical conditions, then all the safety guidelines that we've talked about over and over and over the past few weeks, the infection prevention control measures, the social distance, the physical distance. I want to call it physical distance rather than social distance. The physical distances. So you're going to keep that at least 1 meter rule. To make sure we are going to wear the nose mask. We're going to wash hands frequently. We're going to use the alcohol-based rub frequently. But most importantly, he needs to make sure that his diabetes is under good control.
Good condition.
So when we talk about suffering from diabetes, somebody has diabetes, but then because it is
managing it well,
under good control, so your glucose levels are good control. So you should see his primary care physician or his personal doctor before the school reopens. Yes, he's a teacher.
Exactly.
All right. So before school reopens, just to make sure that he's in a good state of health, and then adhere to all the protocols necessary.
You mentioned face mask. There's a question, social distancing. There's a question here. It says, is 1 meter social distancing still required if the two parties are wearing masks and both don't have obvious symptoms of COVID-19?
Absolutely necessary. So the distance, the physical distancing, there's no substitute for it. And that's what one thing I've seen.
But if I'm wearing a mask and you're wearing a mask, what's the point of distancing?
Well, George, it reduces risk. So we are talking about reducing the risk of infection. So it is not just one method, one way. So we are doing an aggregate of safety measures. We're putting everything together. So the mask is not 100%. We've gone into the fabrics, the type of fabrics being used, and whether fabric versus the medical mask.
The medically approved ones.
So the mask, wearing of the mask is not a substitute for physical distancing. So we want to encourage all of that. 1 meter is stretching out your adult, the outstretched hand.
But Doc, I'm worried because airlines are flying Accra, Kumasi, Accra, Takoradi, and these planes are very small. How do you observe the social distance on an airline like those ones that fly domestically?
It's a challenge, and it's one of those things. I don't know what measures they've put in, but the same questions came up when we had to do the Trotsky and the buses, and they have to leave seats. In between, and it's a pressured cabin in an aeroplane, and whether or not, even when you do that in that pressurized environment, that pressured cabin where the air is circulating, whether that is the best. So I know it's a conversation that it's currently ongoing in the airline industry, that in that enclosed space, if somebody's sitting 2 rows behind me, is it safe? But then it's an aggregate of all the measures. So would everybody wear a face mask, in addition?
Let's go back to the phone line. We have a caller. Hello?
Hello, George.
Yes, sir.
Good evening.
Good evening, sir. Your name and where you're calling us from, please.
From Tema.
Uchibuatam from Tema. Please talk to us.
Right.
Doctor, my question is, I'm washing my hands regularly.
Okay.
I'm using sanitizer regularly.
Okay.
And if I don't have, someone doesn't have that, the new face shield. I don't know if it's shield or something.
The face
it's not like mask.
The face shield.
Yeah.
The one that goes like from the forehead all the way down.
The forehead, yeah.
The mini helmet.
The mini helmet. I want to know.
Yeah.
That one too. Is that good?
Right.
Because that one, it covers your mouth.
Yeah.
It covers your face. So that one is better than the next one we are wearing. The both, which one is better?
Thanks for your question, Otibuateng.
Right, difficult question. So during the press, the WHO is having regular press conferences Mondays, Wednesdays, and then Fridays. And during the Monday press conference, that question came up about the use of the face shield as a substitute for the nose mask and all of that. And the answer was that it will still not be recommended that you use that in place of the face mask. You see, we are talking about a virus that is spreading through aerosols. And if you look at the movement when you sneeze, when you cough, when you are talking, the movement of aerosols as they go in different directions, the face shield, there's a distance between the shield and then your nose and then your mouth.
Yeah.
So it is possible that the aerosols that come out, those tiny droplets that you and I cannot see, may move around the face shield.
Yeah.
So the recommendation is still that which covers your mouth and nose directly should be the first step. If you've seen it on television, then at the treatment center, so if you go to Ghana East, University of Ghana Medical School, and then even at our hospital, when we have a suspect case, then my nose mask, hospital nose mask or medical one goes on, then I put that's the N95. Then I wear the goggles as you see me wearing right now. Then the face shield will go over these two as well. That is when we have a suspect case. Yes, so again, I would say it's an aggregate of protective measures and not that this substitutes for that. So actually, the face shield is not being recommended by the WHO for the use by the public.
Doc, in wrapping up, what would be your final message? Because I know we haven't we've done the education over and again. You still go out there and you still see people without their mask. I was at Tudu earlier today and at some point yesterday, and I was wondering, are these people aware what's going on? Do they really care? Do they? Nobody. I mean, and they are sitting so close together, they are chatting and everything. Life, they couldn't be bothered. Is there a real reason to worry?
Yes. Monday, I think we recorded our highest daily incidence rate or rate of infections globally. There were 136,000 new cases a day.
Wow.
This problem hasn't peaked. We haven't plateaued. Most of the time when we turn on the television, we see CNN and the Western media, and they are reporting that, in Italy, in Spain, in the UK, it seems to be going down. But the global picture is totally different. Fortunately for us in Africa, in Ghana, we're not getting the worst form of the disease. We seem to be getting milder forms, but our numbers also keep going up. So 3 words: behavior change, communication. It's so important that we keep at it. We keep the messaging going. It would appear that 3 months we've been saying it and it is enough, but in public health, there's this concept of behavior change communication. You continually have to tell people and remind them all the time that we're not out of the woods yet. We're not seeing the severe forms of the disease. And as we said, it's a new virus. We still don't understand everything about it just yet. Its epidemiology, who it attacks, how it works, the pathology, and all of that. We still don't have a firm understanding. And the understanding we have continues to evolve. So please, let us all stick to the guidelines. No mask, no entry. It's very important. Try and keep that 1 meter distance, that rule. I mean, it's without COVID, it is still even very important.
Exactly.
And then I'll conclude by saying that there are elderly people in every society, in your home. Those of us who are young, who are healthy, who don't have pre-existing medical conditions, I think we all have a responsibility to protect those who have the pre-existing medical conditions are elderly. So let's stick to the guidelines. Let's wash our hands and let's
contact if anybody wants to contact you for further advice.
So a lot of questions are coming in. So 0501 477 340. 0501 477 340. Or they can come by at our Medina branch behind the SG Bank at Firestone.
And that's our drive, Dr. Doc. Thank you very much. We're going straight to Papa Nesto, who's got the news at 5.
Thank you,